Tapuz Medical is proud to introduce the Ecg Electrodes Belt, enabling fast, accurate, and consistent ECG examinations.
The idea came out during my work in intensive care unit in Israeli Magen David Adom, which is like the Red Cross in Israel. I realized that when we come with an intensive care unit to a patient at home, we must perform a full ECG to avoid a cardiac event, which is the #1 cause of death, especially in males in the Western world.
Tapuz Medical provides several models of universal and dedicated electrode belts for rest ECGs to fit both men and women. The ARH belt, a dedicated model with chest and limb electrodes. For contact, wet the electrodes with cotton dipped in water. For more hairy patients, spray or gel can be used. The arm electrodes are placed in the belt's handles, right leg or ground electrode on the right side of the belt, and left leg electrodes are attached to the left ankle with a clamp. This model connects directly to the ECG device. The ARS belt, a dedicated model similar to the ARH, but with adjustable straps instead of handles. This model is recommended for use in ambulances. The straps are suited for use with extra large or extra small body types and provide additional pressure over the V1 and V2 electrodes for better positioning.
The performance of 12-lead ECG demands anatomical knowledge of the skeleton, and that's why in many countries only special technicians are performing ECG, and you cannot carry an ECG technician with you in the ambulance when you come to an emergency case. So I was looking for a way of simplifying the procedure. So basically everyone with a very short training can position the electrodes on the chest wall.
The 6UH belt, a universal model with chest electrodes that connects to the existing patient cable of the ECG device with banana plugs, snaps, or crocodile connectors. Limb electrodes are used from the patient's cable. This model is equipped with handles and fits almost all ECG devices. The 6US belt, a universal model similar to the 6UH with straps instead of handles. Cleaning the belt is done with cloth dipped in alcohol or chlorhexidine.
When I do an ECG using this belt, the response of the patients is usually quite fascinating. They used to say, "What, are you done? It's all?" It used to take 5-10 minutes, especially men with hairy chest or big women, sorry. I do an ECG in less than 60 seconds, usually in most of the cases.
Putting patients at the center, at Tapuz Medical, we understand that time is a critical factor in administering emergency medical aid and also important in routine examinations. Our new method is much more convenient for both patients and medical personnel performing the ECG.
I'm using this belt for over 6 years now, and it's saving me so much time. As a very busy cardiologist, I recommend it to my colleagues at every occasion I have.
In today's world, time is a critical factor. In emergency situations, saving time can mean saving lives.